Hi guys, welcome to Life Matters and Adedire. This is another amazing episode of the show. I am super excited. Do you want to give a round of applause? Yay! I am pumped. I am super pumped. I'm super pumped. Yes, hope you're enjoying that music. Welcome back, guys. Welcome back. I am super excited, super pumped to have you here with me. Okay, so my guest is ready and I am super pumped. Welcome, guys. If you've not shared with your friend, please make sure you go share. I'm going to be adding my guest right now. We're going to be talking about everything else. Okay, my co-host is saying hi to everyone. Say hi. Okay, so we're ready to chat, right? Welcome. Oh my god, that was so loud. Okay, guys.
Hey,
Can I hear you? Why can't I hear you?
I can hear you on your end.
That's weird. That's very weird.
Can you hear me okay?
Okay, so can you say something so that I can hear you?
Yeah, sure. Can you hear me?
Okay, I can't
No.
hear.
You can hear? Okay. Let's see if it's on my
Can
end.
everybody hear my guest? If you can hear my guest, please type in the comment section that you can hear my guest. I just want to make sure that it's from my end and not from
Can you hear?
let me see. We can hear both of us, so that means it's from my end because I can't hear it. So that's.
Oh, really? Okay.
I think
Yeah, I
it's
can
from
hear
my
you.
own end. Okay.
You can. I can always go off and come back again to try to see. Coming back in.
Yeah. Guys, just give me 1 minute, please.
Okay.
Let me try this.
Yeah, I can hear you.
Okay, so
Can
you
you
can
hear me?
hear me. So I think it's my speakers
Okay.
that's giving me issues. This is very weird. You can hear him. Okay.
Yeah.
No, I'm not using headphones, so right now I'll actually be hey, be coming down. I have an echo, right, guys? I know that. Just give me 1 minute.
She's a tech guru. She'll figure it out.
I can hear you now.
You can hear me? Okay. Very good.
Okay, guys, welcome to the show. I have a famous bell. Let me use my famous bell. I love this bell. I got it I think it was 2018 or 2019, and I've absolutely loved it since then.
That's awesome.
So today we have Dr. Dapo Akinsipe. He's a medical doctor, lecturer, businessman, so many things in one. So let's first get to know our guest. Then we go into there's an echo. I don't know why there's an echo. Okay, so let's start from here. Tell us a little bit about yourself, what you do, and how you enjoy the weekend, like outside you doing the show.
Okay, perfect. Yeah, thank you, first of all, Anu, for having me on the show. I really appreciate it. So my name is Dapo Akinsipe. I'm a physician here in Alberta. Fortunate to be a board certified doctor in the US and in Canada as well, because I did my training in the US as well and worked there for a bit. I'm a hospitalist physician, so generally acute care in a hospital setting. I also do some outpatient practice as well, so some general practice as well as some addiction medicine, from drug withdrawal and stuff like that, which is very prevalent in our community. And then I'm also a clinical assistant professor at the University of Calgary. So I teach medical students, I teach medical residents as well. And, as Anu said, I also dabble in investments as well. So I do some businesses here and there. And of course, most importantly, I obviously believe in God, which is number one. And I'm a husband and a dad of two lovely kids, Ariana and Nathan. So that's me in a nutshell, I guess. Yes.
Nice. So tell us what you do on a weekend like this. What would you be doing if not probably live, like talking to me right now?
Right. So it really depends. It varies. Some weekends I'm on call in the hospital. So pretty much I'm covering the hospital for sick acute patients. And some weekends when I'm off, just spending time with the family, wife and kids, doing stuff. Pre-COVID, obviously going shopping, all those things, but those things have died down a bit, right? So, but we just try to have fun together. Obviously try to be socially responsible and physically responsible with COVID, but essentially it's just family time. Usually, what I do my weekends. Yeah.
Okay, so my first question will be, when COVID first hit,
Yeah.
how were you doing?
Right. It's funny because we actually, how on last year March is when we actually did all the lockdowns and all that, right? But some of us in my own community, we already knew about COVID-19. I would say probably from December last year or January, but then we didn't think it would be to this scale. We thought it would be like something very minimal. Actually, even like a few weeks before all the lockdowns, my wife and I even went on vacation to Barbados for like a week, because then we didn't really think, and then they were just asking, "Are you from China?" We didn't really think it was going to be this magnanimous, right? But since things have hit, we unfortunately, we've seen different waves, and unfortunately, when you work in the hospital setting, you unfortunately see the worst situations. But it's one of those things that I know we're gonna get through it eventually. So, we just take it day by day, right? Yeah.
So someone wants to ask you a question.
Yeah.
Hey,
You okay?
to ask everybody a question.
She needs
She
the
wants
full
to
time.
sleep.
She's the main
So,
star in this show. So
my second question will be, so for so many doctors, and when I was asking how are you, it was more or less. So, Mama, what do you want? Okay, so
she's so sweet.
I've seen a lot of people struggle with their mental health,
Right,
even as doctors.
right.
How do you think so many doctors were able to cope through it, and how are they able to cope through it till now? Mama, let
Right.
me know. Just because I know a lot of them struggled with it. When it first hit, and a lot of nurses were quitting, a lot of people left the hospital.
Right, right.
How did most of
So,
them cope with it?
right, that's a very, very, very good question. So yes, there is, I would say yes, maybe it's 50-50 or 60-40 in terms of doctors coping with it. Not sure if you're still on or not.
Oh yeah, I'm on.
Yes, okay, perfect. So it's 50-50 or 60-40. There's, or I would say maybe 60-40. Maybe 40% of doctors are, generally with everything going on, under a lot of mental stress, because it is very tasking, not only for patients, but on doctors. So I think a lot of people have upped in terms of counseling, therapy, which is very key. And I tell that to everybody. Almost everybody needs counseling, not just some people. If you grew up in an African household, you don't think therapy is there. You don't think mental health is a real thing, right? So you tend to dismiss it, right? So I think a lot of doctors have been seeking. Some people have left the profession, obviously, nurses and stuff, because it's very tasking. I think maybe the rest 60% or so, and I think I would say for me, maybe it was helped. Obviously, I'm fortunate to have a family that's been well and alive and all that. So that's helped, my free time I spend with. But also, I think knowing that eventually there's going to be a light at the end of the tunnel. This isn't going to be forever, right? It's delayed gratification. As a doctor, you're somehow used to delayed gratification. I mean, you go to school for 8 years, right? You do training for another 3 to 4 years. So it's one of those things that eventually things are going to get better. It's just going to be a matter of time. So we just take it day by day. And when we signed up for the profession, at some point there will be a pandemic. At some point again, so you kind of know that going into the profession, I would say most people, maybe not all, that this could potentially happen. So I think maybe from my perspective, maybe because I know these things could happen, maybe I'm a bit more mentally prepared than people generally that didn't know this could happen, right, at this magnitude. So maybe that's what helped me a bit. I don't know, I guess, right? Yeah.
So how do we balance things? Because I when we first started, I was even thinking that if doctors are struggling,
Right.
okay, I'm hearing an echo.
Is it okay, I think it's gone. Can you still hear
Okay,
it? Okay.
yeah, I can still hear it.
Okay.
That's so what
Can
I
you?
wanted to say basically is for the average guy out there or average woman out there that would want to seek help and can't afford it because they lost a job and a lot of other things. How can they deal with that in this kind of season where now in Ontario there's a stay-at-home order, so they can't even go out, they can't visit friends. Some international students are stuck in their rented apartment,
Right.
and suicide rate, divorce rate went up. How do we deal with these things if you're saying, oh, let's go therapy, but I can't even afford therapy?
Right. Right. Very good point. I'm happy you asked that question. It's a very tough situation for two reasons. A, like you rightly pointed out, most people can't afford therapy. I think some therapy sessions are about maybe 200 an hour, which if one is doing it once a week, that can add to your budget, right? Um, I'll go start with Alberta, and I'll go to Ontario. And all over Canada. Sorry. So in Alberta, one of the things I've noticed and I do an outpatient practice part time, is there are actually now resources, and this is for you guys to know, because again, even if you don't think you need therapy, try a one-time session, and then you can say, okay, at least I don't need it. Because again, with us that grew up in African homes, we feel that therapy is non-existent, mental health is non-existent. It's most likely spiritual, right? But what I would say is, I would recommend, there are different, and Jenny, talk to your doctor about this. There are different facilities. One of them here in Calgary is called the OWLPOD, OWLPOD. I don't have any stake in that clinic or anything. I'm just saying because I've referred patients there. But what happens is that you have actually licensed doctors that are actually trained in psychotherapy, like intensely trained in psychotherapy. So because of that, the government actually covers it. So when you talk to your own family physician, ask them about referring to a facility or a place that is covered under Alberta Health Services, so you don't have to pay. And you're going to get the same result as, for the most part, as seeing a psychotherapist, but you don't have to pay out of pocket. And then if you try, you don't like it, and you want to use another resource, there are different resources out there, which maybe at the end I'll have to send a new link through Health Canada and all that. But usually for Alberta, that's a way not to avoid having to pay. The other option becomes Ontario, which is a very tricky situation, because I do have a lot of friends and family friend members and stuff in Ontario. They're having it a lot harder because they've pretty much been on lockdown since, I mean, like for months now, right? And it's affected a lot of people's livelihood, a lot of people's mental health. They're not able to see people, touch people, which is very important for communication, right? And for mental stability. What I would say for people in Ontario is, Also talk to your family doctor. I believe there are resources under OHIP that will cover mental health that you can refer to. Now with the pandemic, I think the government has put some resources into that. So talk to your family physician or ask them about some services under mental health that you don't need to pay for, so you can get referred. Because again, it's very key. Like, think of it like this: your physical health, for example, if somebody was, for example, you were to cut yourself, right, and have an open wound in your arm, right, you're going to need a doctor to suture your arm, right? Everybody knows that. Most people can't suture their own arm, right? Same with your mental health. Treat your mental health like, I would call it, it's a medical issue. So you need to see a specialist in that area. Most people cannot take care of their mental health on their own. Talk to somebody. It's hard now because you can't see your family members, you can't touch your family members because of isolation and all that. It's very hard. It's hard for everybody in Ontario, unfortunately. But try to see a mental health specialist, talk to your doctor, connect to somebody, reach out to somebody, even if it's a Zoom session. Trust me, it's going to make a difference. Talking out your mental health issues, getting some solutions, very, very key. And especially for us Black people, and it's not just Africans, Caribbeans, all of us, generally from a Black family history, we don't talk about mental health issues. We just don't, period. And a lot of the issues we're having now, and if you look at, for example, Nigeria, somebody, you just hit their car, they just go crazy. It's not that they're crazy. There's been a lot of mental health build-up issue that just blows up. So you really have to see a mental health specialist. There's no shame in having mental health issues. Depression is real. Anxiety is real. All this stuff is real. It's not all spiritual. Okay. So very key. Mental health specialist. Yeah.
You're very, very correct. I also wanted to ask this question.
Mhm.
On the stead of a lot of men that don't speak out, that I wanted to touch on, because last week I touched on women take care of your health.
Yeah.
But for men, a lot of men don't speak out because they don't want to be stigmatized as the guy that showed up. So what would you speak to a man right now struggling with his mental health and doesn't want to say anything because he doesn't want to be labeled in the society?
Right. Very good question. Yes, for men, we have this. Uh, for men, we have this thing that we want to be tough. Especially, I would say, especially African men. Let's go back. We have this thing whereby we want to be tough regardless, right? But remember, your mental health is like any other health, right? If you have high blood pressure and your doctor says, "Hey, you have to be on blood pressure pills," you're gonna take it. If you have high cholesterol, you're gonna take it. Treat your mental health as something that needs to be taken care of. Now, I understand that it's not easy. Again, depending on your structure, maybe whoever is around you, if you're vulnerable, maybe they'll take advantage of you. So that's understandable. If you're not comfortable sharing with your circle, that's okay. Maybe what you need to do, like I mentioned before, find a family doctor, get hooked up to a mental health psychotherapy. You don't have to tell anybody yet. If you're ashamed about it, although again, mental health is nothing to be ashamed about, but I understand if you're not there yet, talk to somebody, call your mental health specialist, call a friend sometimes that you trust. I know, guys, we don't talk about mushy stuff, right? Right? Maybe ladies are a bit better with that, but we don't talk about stuff like that. But talk about it. There's no shame. You're a human being, right? Yes, you have an XY chromosome, but you're also a human being, and you just like your physical health, right? Your mental health is also a component of your well-being. So we have to always treat it like that. Don't be ashamed. That's my big key.
So during the pandemic, a lot of people were cooking and a lot of people added calories.
Right.
How do you stay
Sorry. Sorry about that.
how do you stay healthy and in shape? Because I know a lot of people that let me see. Okay. So I know a lot of people that they struggled with their eating habits before the pandemic. And they struggled with, oh, this new dish, that new dish, this new this. And they did it a lot of times. And I saw a lot of recipes online. And in my head, I'm like, but I'm adding weight. Or how am I able to still stay healthy and fit? Because I know that I'm not going out. I'm always at home. And it even makes it worse because some of us are even on maternity leave with it. So so we are locked down. So how do we cope by eating healthy and being fit as human being on the streets of life?
That's a very good point. So yes, it's been very hard. I guess I'll give you my experience. For me, I guess because I'm a frontline worker, I haven't really stayed at home, right? And so my life has continued like pre-pandemic. I had to go to work and all that kind of stuff. Although I do more Zoom patient conferences, but so for me, I guess I've been active. But I understand for the general population, it's hard because the gyms are closed, right? Your office is like your pantry is like right next to your office, right? So the trips are frequent, right? So I get it, and so although I guess yes, I also stay. Although when I'm not in hospital, I'm at home a lot, and my wife and stuff is at home. But I think maybe what may help is uh, it doesn't hurt to do to probably look into some home physical exercises. Nowadays, there's YouTube, there's people that do stuff online, blogging, Instagram, all that kind of stuff. You can always go online and look for tips. A lot of people too, as well, are eating, and that's the next component. There's a component of okay, I'm bored, I'm just eating. So that one easily boredom can be resolved. You just find some workout tips. But there's also stress eating. A lot of people are depressed and anxious, and due to that, are eating due to stress. And because you're at home and not really seeing people, it's hard generally to know if you're putting on a lot of weight that could be unhealthy for yourself. So I think it goes back to aside from saying okay, I'm not going to eat, which discipline is not easy, right? You're not say I'm not going to eat and stop, right? So what I would generally recommend is a lot of the overeating is likely from mental health stress. Uh, Recommend going back again. Try to talk to your doctor. Try to see a mental health specialist. Don't be ashamed. Like, if you're ashamed to tell your doctor that you're having mental health issues, maybe because it's from the same culture as you or whatever, go find another doctor. Your mental health is as important as your physical health. And I know anyone wants to ask me something. Yes. Yes.
Okay. So I think the echo I get is when you're live with me. So I'll just mute you and I'll continue talking. So you just talked to something that the opposite was the case for me. So when I struggled with not even mental health, but just normal physical health, and I wanted to like use certain drugs and all, like I think I was having also at some point, right? And I went to this doctor, and some of them would just treat you like another tick on the box for the government to say I treated the patient. And when I start using a doctor that is in my, like, I know this person knows me really well, I felt more comfortable to actually just pour it all out that, sir, your child has come again. Like, I'm tired. And it was the same thing for my OB. Like, he was a Nigerian doctor. He was really great. I didn't have any issues. I think the only, I think the only other issue will probably like, oh, maybe he will like go over time with another patient. And which, to be very sincere, the only reason why I'll probably be angry about it is because he's like my same skin doctor, like he's a Nigerian. On a normal day, I go to the clinic and I'm supposed to get there for 2 o'clock. I get there 2 o'clock, and those doctors don't show up until like 2:15, 2:20, right? Sorry, just 1 minute. Okay. So a lot of times it happens to me on my own case that I feel really comfortable sharing my own health stuff with someone that looks like me because I know they'll be able to understand my mannerisms, what I feel like. If I do, a doctor will say, okay, what exactly is going on? If I do that with a doctor that doesn't understand my mannerisms, he won't get it. But so when you now said, maybe you should go to someone if you don't want to talk about it, what if the opposite is your case where you are okay to do that, but still some people still don't feel comfortable going to their doctors, they go to their pastors. And a lot of pastors are taking the roles of doctors. And I want you to touch on that before we go I speaking about it, like still going back to the mental health of things. A lot of people have taken things they're supposed to take to the past, to the doctor, to the pastors, and so many times pastors will say, "Oh, go meet this," and people just struggle. So how do I deal with that struggling of opening up to a stranger if I can't even open up to someone that looks like me? I think that's where my question stems from.
Yeah, very, 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 very good questions. So I'll address. So the first point you have is very true. I can even say personally, when Black patients or African patients walk in a room or see me in the hospital and they're like, "When they sigh of relief, like, somebody that understands me," right? So I get that 100% with that. I think yes, that's very important. That representation does matter. I think culture does matter because then you're able to understand better. Very, very key, especially with health issues and being dismissive and all that. Those things are very important. With mental health as well, it does matter. Now, the reason why I also mentioned potentially seeing another doctor is because culturally, I mean, for example, Nigerian doctors know mental health is real, right? But there may be some other certain countries and cultures whereby mental health is only seen as a spiritual issue. So you can always then ask your doctor that you're comfortable with, "Hey, can you refer me to somebody for mental?" Your doctor's not going to say, "No, I can't refer you," right? Legally, they can't do that, right? So then you can now go find somebody else that you can talk to about your mental health. Now, with that said, having somebody that is familiar with your cultural background is always a huge bonus when it comes to mental health. Why? Because a lot of our mental health issues actually stem from your childhood, not from your adulthood, right? And so the formative years of your life, when the mental break takes place that you don't even know it has taken place, is where somebody can be able to dig back and be able to touch that. It always helps. Now, with that saying, it doesn't mean that the person is not of a cultural background, they can't relate. But it always helps when the person is saying, "Okay, I'm from so and so background." When you're telling your story of how you were raised and all that kind of stuff, the person can then say, "Okay, I can have a picture of what this person went through. This is how I can address it." Because again, a lot of our mental health issues, we have to remember, are from actually our childhood, not from adulthood, from trauma, right? A lot of us in the African society, we have PTSD, we have a post-traumatic stress disorder, and we don't even know it, right? And when you talk to somebody, is when you realize, "Oh, wow, I actually have PTSD." And PTSD is not, we always think of PTSD when we think of war, right? That's not only war, it's any type of stress, right? That's why it's called post-traumatic stress disorder instead of post-traumatic war disorder. So any type of stressor that caused trauma, right, in your life, then after that, post means post, past, like pre and post, right? So a lot of us in the African community have that at some point. And so having someone that can relate to that helps. But again, I've also met some, because I'm in the medical field, I refer people all the time. I've also seen some of the white therapists and stuff that also help a lot of our African brothers and sisters. They can somehow relate to it. So we can give that person a shot, see if it doesn't work, find someone that can relate to you. That's number one. Number two, about the pastors. Pastors are great. Pastors do a lot of stuff. I mean, they're your counselor, they're there where you give birth, right? But also, pastors are also human beings. We have to remember that, right? Um, as good as your pastor is, uh, if just like, I mean, if you were to cut your arm, right? Are you going to go to your pastor to sew your arm together? Probably not, right? And do you know the reason why you won't go? Because your pastor is not trained to do that, right? If your pastor is not trained on mental health issues, it's going to be, and you don't take offense from them because they're not trained to do it, right? It'll be hard for them to address your mental health issues, even if they have good intentions and they want to do the right thing. So even with that, it's okay to talk to your pastor, but at the same time, if your pastor or somebody else would refer you to see a mental health specialist, you should go do that because again, they're trained to do it. They're trained on the mind and how the mind works, how to deal with it, right? Your pastor is well trained on the spiritual issues, which is part of your body, right? You have your spiritual, your mental, your physical, but your spiritual and mental don't always cross over, right? Just like your spiritual and physical don't always cross over all the time. So you have to address one issue and the other to be whole as a person, right? So.
Thank you very much. I think you touched on it. And one of the things we've been because my pastor is a doctor. So and the assistant pastor is a doctor, and we have like 2 or 3 other doctors in the church. So one of the things they've been trying to put together is to see how they can connect counselors and counselors with church members, where you can go to this particular either clinic or whatever it is if you want to talk about things, because some people still have those church scars, if I'll use that word, that, oh, I shared my problem with this particular person, this particular church, and I wasn't able to, I was hearing them using it to pray and say, oh, I remember sister, this, or I remember that, right? And some people, it's just a place of discipline, not necessarily, how do I call it? And it's not necessarily that, oh, they're fit for it. So my pastor has actually been trying to put things together, like where we can have something stationed like that in church, so that anytime you have that issue, if you don't want to talk to them, there is another outlet you can talk to, and it will help you in your health. Another thing I wanted to touch on is people's scare for the vaccine, because I know a lot of people are actually really scared that, oh, well, COVID just happened, and everybody's like, no, people have been doing so much research on COVID before it hit. So the medical field has been proactive and not reactive to COVID-19. So if someone's out there that is living in fear and also doesn't want to take the vaccine just because they're scared that some people say, oh, it will change your DNA, oh, it will give you this. Oh, I have heard even from medical people, and I'm like, and you went to medical school. And so that's how that thing, right? So what would you tell someone out there who is really scared of going to get the vaccine? Why should we get the vaccine?
Points, good points. I knew that you mentioned. So I'll kind of explain how the vaccine came about, so it makes sense, and so we can kind of go from there, right? So the COVID-19 that we have now, right? The other name for it, if you look it up, is called SARS-CoV-2, right? If you guys remember, a few years ago there was SARS. If you guys remember that SARS breakout, and then all of a sudden it went away, right? That was SARS-CoV-1. So that virus was similar to this virus that we have, okay? So back then, a few years ago, they were already working on a vaccine. They already started the process, and they were this close to do it, but the cases started coming down for SARS, right? And so it was one of those things whereby, okay, all right, case closed. So we said we hold off. Now, when this COVID-19 came about, which called SARS-CoV-2, right? What they did was two things. They took the research that they already completed from before, right, which was shown to be potentially effective, but didn't go through phase 4, because again, there's 4 phases trials of getting through stuff: phase 1, phase 2, phase 3, phase 4. And they essentially put it into that already and said, okay, this is what we're doing. We already know what this looks like, and we're able to develop a vaccine. Number 2 is the mRNA vaccines, which they have already. They actually started studying mRNA to tackle things about 20 years ago, but they were trying to apply it towards cancer, right? But now they found that, okay, they could apply it to the vaccine because they tried it for SARS-CoV-1, all that kind of stuff. The concern people have, which is understandable, is, hey, COVID-19 just came about last year. Actually, it came out November 2019. That's why it's called 19. But most people heard about it in 2020. How come there's a vaccine already? Usually vaccine takes years. Well, the difference is this. Number one, in the past, people didn't put billions of dollars into a vaccine that fast. So it took about, I think the fastest vaccine took about 5 years. I think it was the MMR vaccine. That was the fastest vaccine back then. But now there's billions of dollars into it. There's a lot of research into it. And then they did studies on about 70,000 people before it was released, and actually found out to be more effective than the flu vaccine that we get every year, the jab that we get every year. That's like, oh, right? And then the other thing too as well is, the more popular vaccines we have now, there's different ones, different of them, but right now in Canada we're using 3. You don't actually inject the virus into you, right? You essentially, what you're doing with Pfizer and Moderna and with AstraZeneca, which is about similar, but the concept of each one's, although Pfizer, Moderna, and AstraZeneca are a little bit different. One is mRNA, one is DNA, which I can explain later. But the concept of it is to trick your body into thinking that you have the virus, so that you build the immune system So in case the virus were to attack you, right, your body is already aware and alert and can prevent you from getting sick. The reason why that's important is this. The first time, if somebody gets COVID-19, right, your body has never recognized that before, ever. So for your body to build an immune system, it takes at least like 3 days for your body to be like, okay, let me start attacking. Now, in those 3 days, the virus is not going to wait for your body to start attacking the back. It's going to start wreaking havoc in your body, right? And so the chance of you getting sicker because you've not been exposed to it is exponentially higher, right? Even when you're vaccinated, you can still get the virus. The difference is that now your body already has an immune system response. Even the variants, by the way, there's even if the variants maybe may not be as greatly effective as the non-variants, but there is still a response. So your chance of actually getting really sick is significantly reduced. So hence why vaccines are good. Now, understandably, in the Black community in general, there's a lot of hesitance of vaccines because of prior history, experimentation, all that kind of stuff. Pfizer being one of them. Back in the 90s, they did experiments on kids in Nigeria. So I get that. With now, though, there's a lot of ethics involved that that's not the case. And one thing I can assure you too as well is the vaccine we're getting and any other race is getting is from the same pool. They haven't altered anything. So it's not anything targeted towards Black people to take us out or to reduce our population, right? All that stuff, right? Everybody's getting the same vaccine. The same vaccine I got, the same vaccine my white colleagues got as well, right? We were all there. All of us, I looked, okay, this is the same. We all got the same vaccine, right? So, I can assure you that it's the same thing. So I do get the hesitancy. I do get the fast, like, people feel it happened too fast. But this is something that's been studied for years, and it's actually even more effective than the flu vaccine we get every year, which we've been having for decades, which I think is amazing that it happened in such a short time, right? Without even injecting the virus into you. So I would recommend it if that's something anybody wants to do. Firstly, I don't feel we should force it on people, but I would highly recommend it. And so, yeah, that's kind of my take on the vaccines.
So, let me be very truthful. I've been thinking about it. Like, I've been like, okay, so I've never even gotten the flu shot in itself. I've never gotten the flu. Like, if I'm tired or whatnot, I think the max I've taken for drugs is what they call this thing, Tylenol, Advil. That's like my max. So I think my hesitancy about it is more or less on the stead of I'm not this injection person or going to. I think that's my own whatever. I don't think that. I think if it becomes mandatory, where especially for the health of children, because once mat leave is over, I'll start going to work, and when you start going to work, then you get more exposed to like other people out there, right? So for me, it's more or less the safety of her safety is more important than anything else, right? If that's what it will come to. But I think everybody's just trying to chill and see, okay, these people that have taken it, let's see what's going to happen to them. I think that's more or less what's going on with most people. So still on the vaccine. So I've seen people say, oh, I've taken it. They felt really ill. I know someone that was in bed for over a week, almost two, just because of that. That was just the first jab, right? And a lot of people are saying, why are people reacting that much to it, where people are going through pain after they take even the first jab before taking the second or the third one? So what would you say about that when it comes to people that have taken it and are falling really ill?
Yeah, so good points, I knew that you mentioned about starting with the flu vaccine. You have a good point. Yes, there's a lot of people that don't get the flu vaccine every year and don't get the flu, right? And that's a very good point. And actually, the reason why also that occurs is because there's something we call herd immunity, right? So when enough people are immune to a virus, right, or get the vaccine or whatever, which is enough immunity, the chance of transmission becomes significantly low. Why? Because if for example, I get the flu vaccine every year, but if the influenza were to hit me because I'm high risk, I work in a very sick patient, because I already have the immune system to it, the chance of me taking in and falling sick significantly reduced because again, my body's attacking it. And because I have less viral load, the chance of me transmitting to you is even less. So even though you may not get it and other people may not get it, the fact that enough people have gotten it, it also resists. Same thing too, I think eventually will happen with COVID, because I think COVID-19 is going to be around for a while. Hopefully we can eradicate it, but it'll be around for a while. Because enough people are immune to it and getting some immunity, the transmissibility risk generally was likely reduced, and the chance of you getting it if you don't vaccinate will be less. But we don't know that, unfortunately, because this is the first year of the virus, right? As opposed to the flu, which has been here for 100 years, right? And so generally, people would vaccinate because just to protect those maybe by more vulnerable. Generally, I would say for you and younger people, the risk of you really getting sick from COVID is probably lower. But also, if you give it to somebody else, which has a lot of immune system or a lot older, then so it's more of like protecting somebody else, right? Your daughter too, as well. If somehow she's exposed to it, the risk of her getting really sick is probably significantly insanely low, right? And so I do understand as well. People do want to watch and see what happens, But at the same time, too, I think a lot of it is doing it to protect yourself, obviously, but also others. And then the second question, which you had, which is very important, is a lot of people do get sick from the the vaccine, sorry. Now, there's two ways to it. There are people that have severe allergic reactions, which is a good point I should mention. If you generally have severe allergic reactions to a lot of things, which there are people like that, I would say, okay, maybe be cautious with the vaccine, because if you react to everything, there may be a chance that you may be reacting to something in the vaccine. So you want to be cautious with that. Talk to your doctor about that first before you get it, just to make sure you're not allergic. But the second thing, which you mentioned, is some people get really sick from the virus, right? Meaning they feel chills, body aches, all that stuff. Well, the thing about it is the reason why people are sick generally is not actually the vaccine making you sick, but it's actually your immune system ramping up because it's confused. Like, yo, there's no virus. What am I attacking? What am I attacking, right? Right. And so you get sick for a week, but eventually it passes away. And the chance of you having any long-term complications from that is insanely low. I think it's like less than 1% or zero. But if one were to get COVID-19, the actual virus, which again, you never know if you'll get it or not. Hopefully nobody does, but you could be fine. A lot of people will be asymptomatic and fine, but you could also get sick and you don't know what the long-term complications of actually getting the virus. Because now we're seeing lung issues, we're seeing heart issues, we're seeing, for men even, actually erectile issues down the road. So it's one of those things whereby you don't have to get the vaccine, but the sickness and vaccine still outweighs getting the virus if you look at the risk and benefits. And even if you look at blood clots, for example, the AstraZeneca vaccine, right? The chance of getting a blood clot is slightly there, although it's actually even significantly lower than birth control pills, which we give women like candy, right? And actually, it's even significantly even lower if you actually get COVID, the virus itself. Your risk of getting a blood clot is even pretty high, right? If you smoke cigarettes, it's insanely high. So there's so many other things, right? And so generally, yes, unfortunately, medicine, we're not God. There's nothing 100%. But you look at the risk and benefit ratio, and the risk and the benefit outweighs the risk. Let's just put it that way in a nutshell. Yeah.
You know the the funny thing, when you were mentioning this thing, it just made me think of when when people say, "Oh, don't buy this particular car." It's no, I've heard people say, "Oh, if you put your phone near you, you're going to have this," and I'm like, the car you're even driving has a lot. So the effect of whatever is going on in the world is not just from one stream, right? Almost everything we use, only God that kind of keeps us safe, to be very sincere. Because you waking up in the morning safe is just another testimony that God loves you. It's not anything else. So I think, like you said, if you already have reaction to certain, and I think it's important for people to actually know the reactions they have to certain medications. Like if you know that, okay, if I use Panadol, like I used to use in Nigeria, this what happens to me, I will make sure that I will tell my doctor. And I think it's very important to be transparent to your doctor, to let them know these are the things, or this is the past history I've had with, let's say, Panadol or paracetamol or Septrin or whatever it is, so that they know that, oh, okay, I think you should take a step back to not get the vaccine yet. And when it gets to a particular period, when they change some certain things, then we can start talking about you getting it. So I think that, like you said, it's important to actually sit down and have that conversation with your doctor. And the good thing now, like you said earlier, is you're able to actually have consults over the phone. So it's not every time people have to come to the hospital. So make sure that you still book the appointment with your doctor. But I know you wanted to talk about MR something when you were talking earlier. So I wanted you to touch on that.
Right. Yeah. So so there's different vaccines, right? The main ones, there's like people don't know, there's like 10 vaccines. Like China is coming up with like 4 or 5 on its own. Then in the US and Canada, we have Pfizer, Moderna, and we have AstraZeneca. Those are the main 3 ones we're using in Canada. And then in the US, they were using Johnson and Johnson, which they just stopped April 13th because there was a risk of potentially having your blood platelets get low or form blood clots. So they're investigating, right? So we'll touch on the 3 we're using now, right? The first 2, the most popular ones we always hear about, Pfizer and Moderna. So they use something called mRNA, right? So think of it like this. In our system, everybody has heard of what DNA is, right? So DNA is the building block of life, right? You have your DNA, your cells, all that kind of stuff. So what this does pretty much is think of it like this. They took a photocopy, right, of what the COVID-19 RNA, which is their building block. Remember, the RNA for a virus is like the DNA for us. So they took a photocopy of what it should look like. They transcribed it, the same copy, like they copy, paste, copy, paste. But remember, when you're copying somebody, you're still not the person. You're just copying the person. So they copied it. Okay, this is what it looked like. Put it in a vaccine. There's a lot more to it, but I'm just trying to break it down for everybody to understand, right? So they put it in a vaccine, right? And they put it as a messenger so that when it hits your body now says, hey, look, this is how this virus looks like. Okay, let's attack and let's build an immune system. So when it does that, then you have antibodies, which is what attacks. There's other stuff that attack viruses, but let's just say for simplicity, antibodies then are built up to attack the virus. So that's the first one. The second one is the AstraZeneca, which is a DNA DNA vaccine. So essentially it picked up, because generally when COVID-19 enters you, it uses this thing called the spike protein, right? Which is on the cell of the virus, right? And I wish I would have shown you a picture of it, but essentially this spike protein is what triggers it to kind of go in. Now, what happens with AstraZeneca is it's picked up what the spike protein of COVID-19 should be from a different read sequence of, I think, use a chimpanzee or something. And then they introduce it into a human being. And so your body now says, oh, this is what will look like when I get attacked. So your body builds an immune system to it. So in the case that it does come, then it attacks it, right? We must always also remember that vaccinations prevent you from getting sick, right? Vaccinations don't cure. It's not an antibiotic, right? The reason why a lot of things like smallpox, which most of us weren't born before smallpox was eradicated. Okay, good. She's been a good picture. And all this stuff was eradicated because enough people were vaccinated.
I wanted you to kind of explain if you have any charts you would want us to use so that you can. Should I click on this?
Yeah, the first picture. Yes, perfect. Okay. Picture. Yeah, so you see those little red ugly things on the cell, right? Right. So those little things are the things that will go in and actually go in and attack, right? So essentially, the AstraZeneca virus is mimicking those red things, even though it's not it. And so your body now says, "Oh, this is what it will look like when it attacks me," and you build your immune system to it, and therefore your body is able to fight against it if you were to get the virus, right? So remember, vaccines are protective, right? They're to prevent you from getting sick. Now, somebody may say, "Hey, look, I'm healthy. Why would I want to have something to protect me from getting sick?" Well, that's a good point, right? Yes, there's a chance that if you're healthy, you won't get really sick from the virus. But how do you know? You never know. I've seen people in the ICU in their 20s and 30s with COVID pneumonia. I've seen people in their 90s get COVID and be fine. So you never know. Now, of course, there are risk factors to it, but not always. Obviously, obesity is a big one. Type 2 diabetes is big. Severe lung issues is big. But once in a while, we get healthy people that get it and don't do well. You never know. And part of the reason why is because the reason why someone who is healthy may not do well to it is also how your body reacts to the virus. So it may actually be your body attacking yourself because you got the virus and it's confused what to do. So you never know. So you want to have that immunity if you can. That's what I generally would recommend. You know?
I think this is the most education I've gotten on it, which I like how you broke it down so that people can actually get used to the fact that it's not as bad as a lot of people spread it on WhatsApp groups that, oh, the vaccine is this or the vaccine is that. I think that it's important that, like you said, that representation where we see more doctors that I one way I remember that I was able to listen to something about women's health was there's a group I follow on Clubhouse, and there's just a room filled with doctors, and they just come every week talk about different things. So that's where I tend to gain a lot of stuff. So I think that, like you said, that representation is important, but we rarely see a lot of um black doctors, especially in Canada. I can count how many. Is there a reason why? Because I know so many doctors come from Nigeria, and once they get here, to get back into that system is very hard, right? And I don't know. So you're gonna kind of share with us how you went through your own medicine route. Was it through the US or was it through Nigeria? And for those that come from Nigeria, and probably they're currently in Nigeria and want to relocate to Canada, and I see a lot of people get frustrated and don't want to get back into the system. So what's causing that particular thing?
Yeah, that's a good question. So a few reasons why. So most, and you mostly rightly noted, most of the black doctors in Canada are generally immigrant doctors. Even if they were born here as first generation or their parents moved here, they're usually that. So and also a lot of doctors came from other countries. For myself, and I'll address the next thing I'll address would be how to go through the system. For myself, I already schooled in Canada, did my undergrad. I moved to the US, did my training, did all that kind of stuff. For me to move back to Canada was a little bit less hassle because I'd already done my med school in the US, did my training, and worked a bit as well. So they were able to transfer my credits. Now, what they make it hard for is if you didn't, obviously, if you didn't school in Canada, it's harder. If you school in the US and UK, you have to do a lot of things to prove your, send documents. But what makes it harder is if you're not from the US or Canada, getting back into the system. Unfortunately, although it's improved from 20 years ago, as a foreign doctor, there are a lot of hurdles and exams, which obviously cost a lot of money too as well, to get in the system, so people get frustrated. How are they working to change these things? Well, one of the things, so I even failed to mention, I'm one of the board of directors. There's a group called Black Physicians of Canada, Black Physicians of Alberta. So we're hoping as well, especially in the Alberta end, that we can try to push some things with the college to see about making it a little bit easier for foreign doctors to come in, because we have this, I don't know if I want to call it a brain drain, but we have, in ratio, if you compare us to the US, ratio of foreign doctors to non-foreign doctors is significantly, there's a huge difference, right? Canada tends not to take people from outside, and it's because of the way the system is set up. They want to prioritize people that have been trained here first, understandable, before they get people that can go in from outside. But at the same time too, I think the system is also in a way kind of set up that they may feel, and I have to use my words carefully, but that they may feel that if you're not trained in the Canada or the US, your training is subpar significantly. So they make you want to jump hoops like crazy to get in. Now, our goal, hopefully within the next year or two, is to put things in place whereby doctors don't have to actually jump those hoops. If you can pass certain exams, right, you should be able to go in, not pass this exam, then do this exam, then do this exam, then do this training, then go to this place, and go. There are a lot of things that will change, but I think overall the system is set up that way, not to let in too many foreign doctors, and we're hoping at some point we can change that. So it's more of a systemic issue, because left to it, a lot of Nigerian doctors would love to come and practice in Canada. I mean, it's a great place to practice. Patients don't really worry about paying stuff, which, there are a lot of, it's not perfect. There are some issues here too as well, but overall, it's a good healthcare system, right? And so hopefully in a year's time when we're talking, we can have a better plan on how to get foreign doctors. For now, we're just in the infancy stage of putting things in work. So in a year's time, I'll have a better answer for that. Let's just put it that way. Yeah.
So for someone that right now is practicing in Nigeria and is planning to relocate to Canada, what would you tell them to proactively do before they come in?
Right. Yeah. So good question. First of all, you want to research what province you want to get into. Why? Because some provinces are harder as a foreign doctor to get into than not. As a rule of thumb, provinces that are more rural, if you're okay with practicing in a rural setting, tend to be more receptive because they're lacking doctors. Generally, I know a lot of people that have, not a lot, but I know some people that have gone to Nigeria and they've gone through the, some of the Northwest territories or, more of the north and eastern provinces or territories. And then they go through there, maybe do 1 or 2 or 3 years there, then they're able to practice anywhere. So that's number one. You want to look at where you're eligible to practice. Number two, coming at this moment, again, in a year or 2 or 3, things may change. In order to come into Canada, even if you have your training in Nigeria, they will likely require you to take some of the MCE exams, which you have to put a couple of $1,000s aside for that. So it's not a shock when it comes, right? Before they required you to take 3 MC, 1, 2, 2 part 2, part this, 2 part 2s. But now I believe you only need to take part 1 and then part 2, and that should be enough. Still a couple of $1,000s, but it's something that they require you to take to jump that hoop. Then the third thing as well is knowing that your specialty may change when you come here. So, for example, I will use a field. Okay, so pediatric surgery there are very few of them. At the same time, though, they they're needed few as well. So, for example, a family doctor is needed anywhere anywhere under the sun. There's a family, but some specialties, right? They're so limited. So even if you are doing it in your home country and you come here, there's a very high chance that you're not going to continue the same specialty. And it's one of those things, but it's likely that, I mean, generally, if you're doing, maybe if you're a family physician in Nigeria, or you're doing a psychiatry in Nigeria, or OB, or internal medicine, maybe peds, depending, it's a little bit easier to come in. But certain very narrow specialties, they generally make it harder just because, again, there are generally few of them, and also there are less job availabilities. So they'll want to prioritize people that's schooled and trained here. So just keeping that in mind, that if you come here, there's a chance your specialty will change. And as long as you have all those things in mind, I feel you should go for it. Don't give up if that's what your dream is, right? Eventually you'll get it. Yeah.
Thank you very, very much. I know we have just a few minutes. Yeah, you've come to the end, Abby. Don't give us outro. So one thing I wanted to ask you before you go is, for a lot of doctors and nurses out there that are still, should I use the word, in the shock of all this stress, how do you encourage them on how to kind of balance their work life because of the stress that now some of them even got COVID, right, and now they're better, but some people I learned had to go stay outside their families because of the high risk in whatever organization they were working. For some people, they had to actually quit their jobs. So some people, the hospital actually shut down, so they were out of jobs for months. So how do you kind of encourage them as they go through this journey?
Yeah, so it's a hard journey for a lot of people. Last year made a lot of hardship for a lot of people. Let's just put it that way. What I would recommend, aside from seeing a mental health specialist, which is key, what I would recommend is, it's okay to take out time for yourself. If you're feeling overwhelmed, once in a while, it's okay to shut down everything and say, okay, you know what, let me refocus. Let me do things that uplift my heart, my mind, my spirit. Whether it's you know, if you're if you're Christian, or if you're reading the Bible, praying, whatever it is uplifts you. If you're generally as well, physical exercise, because a lot of it is lacking, because a lot of us are at home and eating all the time. Doing physical exercise, working out, also is a big stress reliever. The other thing too as well is, even though we're all in isolation, uh, and it's hard. I know we want to physically touch people and all that. Get on video, call your friends, talk about something other than COVID-19, right? Uh, Talk to people. People are going through it. You never know what someone's going through. Sometimes you calling the person through what you're going through may also help that person. But just chat about stuff that is non-COVID-19 related. Get your mind away. It's a form of escapism, right? And one thing we always have to all keep in mind, and there's light at the, there's going to be light at the end of the tunnel. This isn't going to be forever. Things are going to get better. Just keep the hope and the faith alive. Focus on what you want to do. Focus on life, and just make ways for you to find joy and happiness and meaning in what you do every day. And I think that'll kind of get you through it. And aside from that, of course, talk to a mental health specialist as well.
Thank you very much. I had a blast. I've learned a lot today. I'm hoping that maybe one day I shall take the vaccine, people. The day I take it, I'm gonna let y'all know that I've taken the vaccine. But I think a lot of people have learned a lot. If you have any questions, just before we go, if you have any questions or contributions, do put in the comment section so we can put out there. I believe that Dr. Dapo still has 1-2 minutes to ask any other questions. And like he said, take a stroll out. The weather is really beautiful, so start maximizing those days that is 21 degrees, 24 degrees. And like he said, reach out. I have tried to do more video calls when I call people now, just because let me just see that person's face. It kind of gives you that sense as if that person is with you, than when you just talk on the phone. And if the person wants to talk on the phone, give people that free time to also talk on the phone. And if you are being stressed, or if you are going through anything that you feel like, you know what, I've tried my friends and I've not been able to get through to them, please make sure that you actually reach out to like a mental a therapist or a counselor or a psychologist, a psychotherapist, or whatever it is. Go into a family doctor to give you that pass for that. But we have to let you go because you have another meeting, so that we can let you enjoy your Saturday. But thank you very, 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 very much. For if people have any materials or anything, how can they reach you?
Yeah, sure. So many ways to reach me. I'm at the Dapsgram on Instagram. You can hit me up there. LinkedIn, you can hit me up there as well, Dr. Akinsipe MD. And email too as well. I guess if they need to reach to me, I know has my contact information. You guys can reach out to me, no problem. I'm here for you any way I can help to navigate. Just let me know, no problem. Right.
All right. Thank you very much, Dr. Dapo. We're super, super grateful. Thanks for coming on the show today. So for those, if you missed this particular live stream or you're just joining us, don't worry. You can watch a replay on Facebook, on YouTube, and you can also watch on every digital platform podcast. So any podcast that you use, whether it's Deezer, Castbox, Spotify, Anchor FM, Apple Podcast, Google Podcast, Overcast, whatever you use for podcasts, don't worry, we got you. So just search Life Matters with Anade Jure, and you'll be able to get this episode on it and previous episodes also of the show. So I want to say a big thank you to Dr. Dapo. My co-host is sleeping because my co-host has to take some beauty nap. My co-host has to take some beauty nap, but thank you very much. God
Thank you.
bless you.
Thank you so
All right,
much.
people.
Appreciate it.
Till we see you next month with another amazing conversation. Have a lovely weekend.
All
Bye.
right. Thank you guys.